Oh, this neck pain. You know, neck pain is very common for people 55 and older, and we've worked with this age group for a number of years. There's two commonalities that always associates with neck pain, and one is limited range of motion, rotation and up, and the second one is poor posture.
So if you want to stop your neck pain, have better sleep, be able to turn your neck when you're actually driving, and look younger, we're going to show you 4 exercises to help get your neck functioning again and feeling better.
That's right. All that's the way it is. Mike, you're doing great, Mike.
This is my shot, Brad.
I'm sorry. All right, now before we get into the exercises, it's absolutely critical that you really understand everything that goes on in the neck, why it's a painful source, and how to correct it. So as we're sitting here, Mike has good posture. Think about the neck. We have the spinal cord going through it. We have peripheral nerves, spinal nerves going exit it from there. And look at the range of motion if you turn to the right, and then you turn to the left. Now that directly affects your vision. If you lose range of motion turning right and left, you lose your vision at that degree. Very critical. Looking up. Very often this becomes less and less with age. We want to consider that as well. So what we want to go do now is look closer inside the neck and look at these structures so we know what we're dealing with and why we're going to keep this neck moving. All right, so let's take a little deep dive into the neck and the anatomy of the structures and nerves, etc. We're going to show you these and you'll understand what we're dealing with.
So to begin with, we have 7 vertebrae going through the neck, C1 through C7, and through that runs the spinal cord. Off of the spinal cord, we have 16 spinal nerves which exit. We also have 2 cranial nerves passing through the neck, and we have a vagus nerve, which helps control the heart rate and digestion, as well as accessory nerves, which control shoulder and neck muscles.
That sounds like a lot to think about, and it is, but we don't have to worry about that to make things work well with the neck. The primary goal is to keep the neck moving, proper posture, and range of motion, and it'll all take care of itself. Wow, Mike, that was like going back to school again. All of those details. Again, you don't have to know all that, but it's helpful. We're going to talk about get into the meat of the exercises, but before we do that, there's 3 precautions that you need to know so we do not have any problems. Number 1, approach these exercises gently. Don't get too aggressive. If they create any pain, any sharp pain particularly, you need to stop. It's not what they're meant to do at all. They should feel good.
And number 2, if you're having severe neck pain that is really intolerable or you've had a neck surgery, then you really want to go see the doctor before performing any of these.
That's right. Also, if you experience any dizziness, lightheadedness, you need to stop. There are some problems there, and then you do want to go see the doctor. Do not continue with these exercises. And I'm almost out of breath. All right, the first exercise, we want to look at posture and address it. We're going to do some stretching. It's a very simple exercise. Mike is going to carry you through it.
To assess your present posture, we're going to do a forward head test. So what you need is a flat wall. I'm going to put my buttock against it and then my upper back. What you want to do is try to bring the back of your head to touch the wall like this. Notice I'm going straight back, doing a chin tuck. I'm not extending like this, rotating my head up. Straight back. If you can bring it straight back, that's a good thing. If you can't, it's okay. Just work on what range of motion you have. And remember to do a chin tuck, hold it, and then go forward. This will test for that forward head posture and help get your range of motion back, which should help with your pain.
Mike, let's even clarify, because it's not uncommon for people to not be able to touch their head against the wall. And as a matter of fact, your father has this issue, correct?
Yes, he does. He looks at his computer and laptop like this most of the day. So
how far does he get from the wall?
He probably gets an inch or 2 from the wall.
Right, so he's a good candidate for doing the chin tucks, not aggressively, but consistently.
Yes, it's something you can do throughout the day. You can just do 5 reps early in the morning, mid-afternoon, and before you go to bed.
Okay, just a brief follow-up from number 1, the chin tuck exercise. You don't have to be up against the wall to do that. You can be sitting down in your while you're working on your computer, and do some gentle chin tucks. You don't have to have your finger up against your chin. You can do it like this. You can do it like this. In 3 to 5 reps throughout the day. Now we want to look at rotation. We talked about rotation, particularly with driving. It's really critical for safety and being a good driver. Mike is a good candidate right now because he has a stiff neck, even though he's only about 35 years old. Look this direction, now look that direction, and you can see he's lost about 40 to 50%. Oh, and there's a little pain. Sorry, Mike. All right, we're going to show you a nice way to stretch this gently. Okay, now this exercise is a little bit difficult, so pay close attention, but it's very, very helpful. And over the years in the clinic, we have found it to be very effective. So take your time with it. First, you need a towel roll. Now, Mike is going to roll it up. Okay, put it over the neck, and you're actually going to kind of put it lower on the neck. Okay, grab it with both hands. Now, this is the tricky part. You're going to actually take the right hand and grab the left tail of the towel, and then the other hand and grab the other tail. Now, the one in front, this one's in front, this one's against your body. This is going to rotate the neck that way. It just adds assistance. Stay right there. Notice it has to go across the jawline. If you do not do that, yeah, then it's hard to breathe and really don't get range of motion benefits. Look at this. This neck, this towel actually supports the neck. It makes it very comfortable. Don't you agree, Mike? He doesn't have his mic on. Mike, you don't have your mic. And so as we stretch that, it really makes a big difference. Now, go back to the starting position. To do the other direction, you have to switch hands. So that hand is there. Now, the hand in front, that's the side that we're going to go to. That's the tricky part. Now, hold on, Mike. This is a real live test. Mike actually has neck pain to the left, as we demonstrated. Does that bother you, Mike, or does it feel better with the towel on? Thumbs up? Yeah. Then go ahead, do a stretch. Let's see how it goes. You're not going to pull so hard that it creates pain, maybe a little bit, but definitely no sharp pain. Gently stretch. In real life, you may do this 3 to 5 times. If it feels better every time, you may go up to 10 repetitions, but just hold and relax. Don't just hold it for 30 seconds. Well, I'd like to have the on and off method for this. All right. You want to do more, Mike? He does. Keep going. Keep going. I'll talk. No, let's put it down. Let's do a rotation to the right. And to the left. Thumbs up. Well, it's better. Okay, we have success. No, this is a really, really nice rotational stretch. So we're going to really give some good attention to that. And the first one as well is really important. These are key exercises. Let's go to number 3. Okay, let's go to number 3. Those muscles on the side of your neck can oftentimes knot up and tighten. Mike is going to show you some nice simple exercises. Don't get aggressive with these. There's your warning.
So the side neck muscles work on side bending or bringing your ear to your shoulder. So to stretch my left side, I'm going to bring my right ear to my right shoulder just like this. If it's tight, this might start elevating. You're not stretching. Try to keep your shoulders in the same position the whole time. We're going to go here. Hold it for 5 to 10 seconds. Now, if this feels good and you want to get a little more stretch, take your fingertips, not your whole hand, just your fingertips, and you can push a little bit there, get more of a stretch. Now, make sure to work both directions to see if one side is tighter than the other. If you want to get a little bit different stretch, this will stretch the levator scapula muscle. What you want to do is, instead of going sideways, you're going to look like you have a shirt pocket here, and you're going to go down kind of a 45-degree angle, stretching this way. It's going to feel a little bit different. If this feels better, then do this variation.
That's right. I had a patient, I showed her the levator scapula stretch, and she was so excited about it at her work. She was telling everybody in the office, do this stretch. It's just beautiful things. And, you know, you're going to find some of these stretches will absolutely change your life and make you feel better. And that's just an example.
Did it change your life?
No, but I felt pretty good about it as a therapist.
There you go.
Let's go go to number 4.
So this fourth exercise is for the person that commonly looks up and they bend their whole head to get a glance up at the ceiling and then back down. This is a stiff neck, and Brad's going to show you an exercise for this.
That's right. And this is also really good for those stargazers. If you're out at night and you want to see the stars, you really need to do this. Just take your towel roll, just like before. You're going to put it low on the neck, not too high. And it's nice to do this in a chair that has a backrest that does not come above the shoulders, but you don't need that. You'll see what I'm doing here. We're just going to do this. I'm going to put some gentle pressure here, not pulling hard. Just snug up the towel. I'm going to bring it down here, and then I'm going to first do a gentle chin tuck. It's important to get that good posture, shoulders back, and gently go up. And if you bring the towel up like this, that will also add a little range of motion. Now, this is important. You can hold and come back. And you can do it down here, whatever feels good. Now, if you do this, you experience any dizziness or pain, you do not continue. You absolutely stop, and I would go see the doctor about that. Most people will not have that. But again, up, and if it feels good, you're going to hold it a little bit longer, and then when you're done, you reassess your range of motion and see if you can look up higher afterwards. The first day you do it, I would do it 3 to 5 times, and then not for the rest of the day, because you might be sore the next day. If you are, that may be normal. Do it again the next day, and after you do it repetitions, it should loosen up and feel good. All these are slow advances. You don't go into anything too hard. I can't beat that up enough. Mike, follow up, please, because I'm rambling.
I think we should start a line of men's scarves that you can do neck exercises with, and we can put your name on it. What do you think?
What about women's scarves?
Women can wear them too.
There you go. Okay, good luck on everything. It's really a good, important, whatever.